and I'm so excited to be here. One of my favorite things about working in HS is that you get to work with the best people in the world, because doctors, patients, everybody working in HS has one thing in common, and it's that we see this terrible challenge and we see people struggling, we see this big need, and we move toward it, and we try to make the world a better place. And that's why people who do HS work have the biggest hearts and just make me feel so great to be around them. I'm always amazed. So I'm so grateful to be here, to be talking to you guys, and to be doing this work together, because there's a lot of work to do, but we are amazing people, and I think we can really get it done. So I'm a dermatologist out of Detroit, Michigan. I work at Wayne State University there, where I have the residents, and we're trying to train the next generation to be better HS dermatologists and trying to reach out to non-dermatologists too. I'm on the board of the HS Foundation, and I'm on a committee called the Impact Committee, where we're trying to sort of get education out there to everybody who needs it, improve awareness, trying to do all the good things that need to be done. And like I said, there's a lot of work, but I'm so glad to have partners like HS Connect and all of you, so we can kind of collaborate and do this together. So like Hurley said, we'll kind of talk about what HS is, because we really want to make sure we're getting the right messages out there to people, because there's a lot of misinformation. I would bet huge money that all of you were told something at some point along your journey that was just wrong about HS, if they even knew what HS was. That was probably the first thing, is someone just calling it something else, or not even knowing the disease name or what it was or that it exists. So there's this thing called neuro-linguistic programming, which is this really fancy term for the words we use and choose have deeper meanings and trigger different thoughts and emotions in people. So the ones that people can usually understand really easily are but. If you say something and then you use the word but, that negates whatever you just said. So if I say, yeah, you can have a party, but you have to keep it small. You're like, I can have a party, yes, but, oh, what's the but? Whereas if I say, you can have a party and you need to keep it small, you're like, all right, cool, I can have a party and I just need to keep it small. Try is another one, and this is one that I have had to fix in clinic. What does the word try make you think of? Failure. Right. Try goes with failure. So I don't say to patients, we're going to try this treatment and see if it works, because then they're in their subconscious, they're going, it's going to fail. We're going to try it, but it's going to fail. So I say, we're going to start this treatment and see how well it works for you. And there are some studies that show with phrasing it that way, it's more likely that it will work for you, because you don't have that mental block in there that it's going to fail. So that's kind of part of the topic today, is sort of choosing our words carefully, structuring messages that we send out to make sure that we're sending the right message and even the right sort of subconscious message to people. So HS, debilitating. I think everybody in the room knows it's hard, it's challenging, it's difficult. Chronic, which means it's ongoing. It's not like an infection, you get it, you're cured, you never worry about it again. Complex inflammatory illness. So inflammatory is inflammation, your immune system kind of overactive, over-responding to things. We don't know the cause of HS. There are some super, super smart people doing really great work, and it was so exciting at our conference last October. There's a few different groups who are working on some genetic studies, and they started to identify some similar genes across the group. So we're thinking we might be targeting in on things, but there's still a lot of work to do. We know that it has to do with maybe some of the bacteria in your hair follicles and on your skin, maybe the hair follicles themselves, maybe some of the oil glands that connect to the hair follicles, the immune system, hormones, stress, diet might play a role, the bacteria in your gut may play a role. So suffice to say, it's complicated. We're trying to figure it out, but it's complicated, and it's probably different for different people. I think if you talk to a lot of people who have HS, you know that there's no predictability with HS. We don't know what's going to work for one person and what's going to work for another. So there's a lot of sort of figuring things out as you go. It presents with really painful, recurring boil-like abscesses. And so abscesses, the medical definition is an abscess is a skin lesion that has a fluid pocket inside. You guys might have also heard some of the other words we use. So a nodule is a kind of solid ball of inflammation. So when you have one of those hard ones and you're like, this can't drain, it's just kind of like a little swollen lump. And then tunnels. And we used to use the word sinus tracts or fistula, but we are moving toward tunnel because technically there's these different rules, like a fistula has to connect from one of your organs to the outside of your body, and a sinus tract has to be lined with a certain type of cells. So we're just keeping it simple and saying tunnels now, which is more inclusive and just easier for everybody. It often starts with pustules, which are like little pus bumps, kind of similar to acne, but not acne, and that's a whole nother thing of kind of people confusing it with acne. And they can develop anywhere you have hair follicles. And we'll dive into that one a little bit more of sort of making sure that we get the message out that it can happen anywhere you have hair follicles, not just in the most common areas. Hurley staging, you guys have probably heard of the Hurley staging. Dr. Hurley was a dermatologist, and the Hurley staging was made as a way to see, do you need surgery for your HS? So Hurley stage 1, we kind of equate with mild, but I will say they're not equal. You can have stage 1 that's severe. So sometimes we use them a little interchangeably, but they're not actually interchangeable. Stage 1 is you get spots that come and go. You don't yet really have significant scarring, and you haven't had any tunnels form. This is the best time to start treatment because you don't have the tissue damage yet, and we want to prevent that. This is also the time where you probably don't need surgery yet. So that's why in this staging system, it was like, okay, stage 1, you don't need surgery yet. Your spots are just coming and going. You need to be managed with medicines to stop that inflammation. Stage 2, you start to get scarring in tunnels, but there's still some normal skin in between the spots. So I've got a tunnel here, some normal skin, tunnel over here. And then stage 3 is where it just takes over an area of your body. So like this whole armpit is full of scars and tunnels and nodules. So in the original system, it was stage 3 needs surgery, stage 1 doesn't need surgery, stage 2 maybe. And that's why it's sort of a simple system. It's a one-way street. You can't really go backwards. If you get surgery, it's kind of a weird one because you're like, well, I don't really have stage 3 anymore because I had the surgery, but we sort of still consider you a stage 3 patient because your disease did that, and it could do it again. So we need to be serious about it. It's not like we reversed things with the surgery. We fixed the damage that was done, but we got to watch because it might do it again. So that's what's hard with Hurley too, is we can't use it to see how your treatments are working because you can get worse with Hurley stage, but you can't really get better because once the damage is there, it's there. But there are treatments for the damage too. How bad is it? How much unaffected skin is between the abscesses? So we have all these different ways for our trials to measure, is a treatment working? And it's not a perfect science. We're still trying to figure out the best way to sort of say, are you better? Other than just asking people, are you better? And I'm sure you all know it's a hard question to ask, like, okay, how's your treatment working? It's like, well, flare, are we talking about flares? Are we talking about how many spots? Are we talking about pain? So that's one of the tools that we use is to say, all right, how much skin is in between the spots? How much normal skin? Because it sort of shows how much the damage is taking over. You can be different stages in different parts of your body. So when they do studies, they sort of will say, all right, whatever your worst one is, if one armpit is totally taken over, you're stage 3, even if your groin just has a couple of tunnels. But you can kind of have different severity in different areas. You're not guaranteed to progress. Not everybody goes 1, 2, 3. So we hope that we can stop everyone from progressing, but some people, even without treatment, just stay in stage 1 for some reason. Some people just get to stage 2 and never go to 3. And that's one of the things I always make sure I tell new HS patients, especially if they're at an earlier stage. I give them all my resources, tell them check out HS Connect, and then I always give the caveat of, also don't freak out because you're gonna see some pictures of severe disease. You're with me now, we're gonna do everything we can not to let it get there. But I kind of warn people because it can be scary when you're early stage and then you go online and you're like, that's gonna happen to me. So it doesn't happen to everyone. I wish we lived in a world and we'll get there where it happens to no one and we shut down the disease and there's no progression. And then there is hope for remission. Hope is so important with HS. That's one of the things I make sure I tell my patients, my new patients every time is I say, I'm so glad you found me. We're in this together. I won't give up. We're going to keep going until we get you under control, no matter what it takes. And sometimes I still can't, it's a struggle, right? Like some disease is just so severe, but I don't give up on people because I'm sure many of you have experienced and heard from other patients, doctors who do throw their hands up and go, that's all I got, that's all I can do, that's it. So I make sure my patients know we're not doing that. I'm with you forever. Your struggle is my struggle now. We're in it together. So probably most of you in the room have heard HS impacts women more than men. It affects African American females the most. It usually shows up during puberty or right after puberty, and it shows up in your armpits, groin, and buttocks. And these are some of these things where, when it comes to myths, there's a little bit of truth in the myth, but then there's also, it goes beyond that little bit of truth and sort of has more power than it should have. So these things have some truth in them, but we'll kind of go through where saying it, being careful how we say it, can make sure that people aren't feeling isolated or left out if they don't fit this picture. And we honestly aren't that sure about all these epidemiology. Epidemiology is where you look at everybody who has a disease or the whole population and say, okay, it's more common in women, it's more common in Black women, it's usually comes on at this age. The hard part with HS is we don't know how many people are out there undiagnosed, and we know it's significant. So we're doing these studies. These are the people who have an official diagnosis, so who knows what it looks like for people who are undiagnosed out there. And that makes it really hard, and it brings some uncertainty into all the research that we do on it, especially when it comes to HS, because there's not an easy test. You can't just be like, okay, well, let's say diabetes. All right, we're just going to look at people's blood sugar and we'll find everyone with diabetes. There's no blood test for HS. So there are people out there undiagnosed that aren't being included in our studies of where it is and who gets it. And like I said, we don't want to isolate people. It's already an isolating disease. You know, a lot of people don't share it with anyone, even in their own family, because it's these private areas. I've had patients before where I ask, does anyone in the family have it? And I always remember one woman, she goes, oh no, I'm sure they don't. My mom and my 3 sisters and I are very close. We talk about everything. We share all our medical info. She came back to the next visit and goes, my mom has it and 2 of my sisters have it. And it's the one medical thing we've never talked about. And I brought it up and they were like, oh yeah, I get boils in my armpits too. Oh my gosh, I get them in the groin. I've had, surgery for it. She said it was just the one thing they never talked about. We also know that people get misdiagnosed. The diagnosis gets missed, where you go and you see a doctor and you don't know what you have yet, and they don't know either. I tell a lot of doctors who are frontline doctors, emergency, urgent care, primary care, I say, if you don't think you've seen HS, I know HS has seen you. And so we try not to focus too much on these specifics and harp on them, because it can make people who don't fit those characteristics feel more isolated. So when we kind of say like, oh, HS is, a predominantly woman disease, then men who get it feel like, oh, you just told me I have a woman's disease. That's very alienating to me, and it attacks my sense of self, and I feel, strange about it now because you're saying that. So we try, it's still okay to kind of bring these things up, but we just want to put it in that context, And I always say, like, even our studies that show it's 3 times more common in females than males means 25% of the patients are men, 1 in 4. That's not uncommon. And then we want to make sure, we're not isolating people in any other ways either. And especially the locations too, because sometimes people feel like, well, do I have HS? Mine's not really bad in the armpits, but I have it in the neck. I have it on the scalp. Is this HS? Because no one talks about those areas. So here's a few things that we know. Anyone can get HS. It doesn't discriminate by age, race, size, body shape, weight, beliefs, blood type, geographic location, sexual orientation, physical disability, intellectual disability. Anybody can get HS. And so that's kind of one of the messages that we want to get out there, is that, you could get HS, anybody can get it. It's not a disease of a certain group of people. And then, where can you get it? I kind of mentioned this a little bit already. You can get it anywhere you have hair follicles. So you actually have hair follicles all over your body. Even though you don't have hair everywhere, you have hair follicles. So that's where if you get real close in one of those horrible makeup mirrors that magnifies too much and your pores look terrible, you see those little peach fuzz hairs even on your cheeks and on your face. So the only place we don't have hair follicles is your palms, your soles, and the red part of your lip, the part where you put the lipstick on. But even just off the edge of it, you actually have hair follicles. So HS can show up in any of those places, because we sort of consider it now a disease of the hair follicle, or a disease centered around the hair follicles. And so that's an important message to get out there. So like I said, people don't feel like, well, I don't fit the picture of HS. What do I have? I don't think I have HS, because everyone says it's in your armpits, your groin, under your breast, your buttocks, but mine's on my thighs and on my scalp. When can you get HS? Pretty much anytime. We do know that it's most common around puberty. A lot of the studies show it's more like 20s and 30s, but talking to people, they go undiagnosed for 10 years, so it's probably very much more common in the teens than we even know, because most of my patients say, like, no, teenage years is when it actually started. I got diagnosed when I was in my 20s, 30s, 40s, but it can show up younger. We've even had babies who present with HS. We've had a lot of kids who are adolescent who haven't gone through puberty yet, so it's not like you have to go through puberty to start having HS, unfortunately. Luckily, it's rarer in those cases, but it still can happen. And then it can happen later in life, too. There used to be this myth, and it's still out there, that like, oh, in menopause it goes away, or you can't get it after menopause, but you can. You can get HS at any age, and there's even some studies that show for older men or more mature men who get it later in life, like in their 60s, it might be more severe. So another thing where we're kind of clueless as to why it can show up at different points and pop up, but it's a good thing to mention so that people understand that just because you don't fit the typical age doesn't mean it's not HS. You can get it at any age. And another myth that kind of goes with age is it gets better with age. For some people it does, thankfully, but not for everybody. So there are people where it just keeps persisting on, and it's really hard to do studies on it because of that tissue damage that happens, because there's sort of, is your disease active? Is it dormant? Do you still have problems from the damage it's done, even though there's not as much inflammation? So it's even hard to kind of study, did it go away, or is it damage left over? But that's another one that we try to kind of dispel. I mean, we want to give people hope that there's a chance it will get better with age, but we're also not going to count on it to get better with age. We're going to continue to take care of our patients. And then there's a few common misconceptions. If I asked you guys to raise your hands, I'm sure you'd be like, yep, heard that, heard that. So one is that HS is rare. We think it's about 1% of the population. Some studies even show up to 4%. And like I said, that is people who have a known diagnosis. So that's 1 in 100 people, which means over 390 people on the planet have HS. So that is not rare. I will quote Brinley because I love this quote. HS is not rare, it is just rarely talked about. And people are like, I am seeing so much more HS as awareness is increasing and people are going to the doctor and figuring out they have HS. And unfortunately, a lot of people have to figure out for themselves and then teach their doctor, which is a whole nother issue that we need to deal with and we're fighting. We also hear a lot like, oh, it's rare in men. Like I said, 1 in 4 in the studies that show it's more common in women, it's still 1 in 4 are men. And then in some parts of the world, it's actually more common in men than in women, which we have no clue. Is that a genetic thing? Is it an environmental thing? Why is that? So it's not always more common in women. And it's another thing where we say, yeah, it's not rare in men. There are millions of men with HS. The other one we talked about is that it develops during puberty. It can happen at any age. And then I kind of harped on this a little bit already of those key areas where it shows up, the armpits, groin, buttocks, but it can happen anywhere. So we still sort of talk about that. And now we try to, when we bring that up, say, most commonly shows up in the armpits, groin, and buttock, but can show up anywhere that you have hair follicles. And there I use that but on purpose to sort of negate that first statement. So it's not like those are the only places. I say, but it can show up anywhere. So that way the focus is on it can show up anywhere. Some people get mixed up. Is it autoinflammatory, autoimmune? So HS is considered autoinflammatory. Autoinflammatory things are like an overreaction of your immune system. Autoimmune problems have a target in your body. The other way we think about it medically is in autoimmune disease, there's an antibody that we can check. You have antibodies against some part of your own body. It might be antibodies against your thyroid, against your skin, against your heart, but we can measure that antibody and know you have the disease. So you may have heard of things like in lupus, there's an antibody you can check to confirm someone has lupus. In thyroid disease, you can check for the antibody and then you know that they have autoimmune thyroid disease. There's no antibody in HS. So it's autoinflammatory. Your immune system is reacting. We don't really know what it's reacting to. Is it reacting to your hair follicles? Is it reacting to the bacteria that are in them? But we know that it's not as simple as an autoimmune disease, because that would actually make it a little easier if there was just an antibody we could check and go, oh yeah, you do have HS, you have the antibody. This is a really big one that we are trying to get doctors to stop
propagating and stop bringing forward is that HS is a sweat gland disease. So a lot of people hear from their doctor, oh, I'm going to cut out your sweat glands. You need your sweat glands cut out. And the reason this one came about is we have sweat glands all over us that do our watery sweat when we're hot. Those are everywhere. And then we have our oily sweat glands, and those are in kind of our sexy areas, our armpits, our groin, our butt, under the breasts. So HS, the most common places it shows up are where we have those apocrine, oily sweat glands. Those sweat glands aren't active till puberty. So that's why you don't have BO until you become a teenager, and then someone has to tell you you've got BO. Start wearing deodorant during your teenage years. And that's why younger kids don't have body odor. So that's what sort of made people think it was a sweat gland disease, because you're like, oh, it's in the area of those sweat glands. It shows up usually around the time those sweat glands become active. But we now know it's more of a disease centered around the hair follicles. And so it can just be confusing for people when they say, oh, you need your sweat glands removed. That's not what the surgery even is. The surgery is typically removing the skin. The hair follicles go with it, the sweat glands go with it. There's no way to get in there and find the sweat glands and pick them out and leave the rest of the skin there. So that's one of the things that we're trying to kind of get surgeons to get away from telling people too, and say, you're not removing their sweat glands, you're removing an area of the skin, you're removing the hair follicles. We also know that laser hair removal can be helpful for HS. So that was one of the big things that told us it's more a disease of the hair follicle. I will say those sweat glands, they don't open to the surface of the skin. They open in the side of the hair follicle. So that's one of the reasons, like also when you get into puberty, your hair gets oilier, is because that oil is going on to the hair follicles. So it's another one where it's like, okay, maybe that's why it kind of came, but it's not a sweat gland disease. And it's more, and there's another reason that we don't want that to spread is there are some treatments for sweating where you can kind of have like heat applied to your armpits if you sweat too much of the watery sweat. They tested it for HS and it made people get worse. So we don't want people thinking like, oh, I'll go get my sweat treated, because it could make it worse. On the flip side, if you inject Botox or botulinum toxin, for some people that helps their HS, and that's another treatment for the sweat glands that produce like the watery sweat. So it's complicated, just like everything with HS, it's complicated. And then weight. This is a big one that we're trying to get doctors to stop shaming people and saying it's a disease of obesity. You have it because you're overweight. It's because your skin is rubbing. We do know that in some studies, weight can be associated with a bigger increased severity, being overweight, but it is not caused by it. It doesn't matter what weight you are, you can get HS. You can get HS if you're underweight. So that is not the cause of it. We don't know the cause of it. Smoking is not the cause of it. Hygiene, not the cause of HS. So it's nothing that you did. HS is not your fault. And so that's where we want to be careful, because sometimes if people hear this like, oh, HS is for overweight people, then they feel ashamed of themselves if they're overweight. They're like, oh, I caused this. I brought this on myself. And what do you do when you feel ashamed of yourself? You stress eat, which isn't going to be helpful for anybody. You eat bad junk food, and it's just not a healthy thing. And we don't want people to feel that shame and blame that HS is their fault. And we're really trying to educate doctors to stop, because like I said, you may have heard that from a doctor. I already kind of mentioned there's this misconception that it's where skin is touching skin. For some people, friction is a flare, but it can be from clothing. It can be in those areas where skin touches skin, but it can also just show up anywhere. Like it can show up on your neck and on your scalp, where it's literally impossible for that to rub somewhere. Definitely not contagious or infectious. And that's one that's really tricky, because that the kernel of truth there, or I guess not even the kernel of truth, the thing that gets confusing about it is it's the part of our immune system that fights infections. So that's why it looks like an infection. If you get an infection, your immune cells show up, they make pus, they fight it, they get inflamed. So it looks just like an infection, and it's confusing, but it's not. There's no infection there. It's just kind of doing the same thing. Your body is like, oh, it feels like there should be an infection here, so I'm going to react like it, but it's not. The other confusing thing is some antibiotics can help. But we know the antibiotics don't even need to kill bacteria. We can use lower doses where they're just anti-inflammatory and they calm the immune system down. But it leads to this misconception that, oh, because antibiotics are helpful, it must be an infection. And then sometimes that leads people to avoid activities like, oh, I don't want to be intimate with anybody because I don't want them to catch it. I don't want to hold my grandbaby because I don't want them to catch HS from me. Or even that idea of something you're doing is spreading it. Like, oh, I ruptured one of these and then I didn't wash my hand and touch this area and I got one. not how it works. It's just going to show up where it wants to show up because it's not an infection. It's not contagious. If we weaken the immune system or calm the immune system with some of our treatments, it gets better. If someone has an infection and you dampen their immune system, the infection gets worse. So there's a lot of things that let us know it's not an infection. And this is a tricky one because sometimes people just use that term kind of not thinking about it. Like, oh, I have an infection. And then it can get infected too, which is tricky. Once you have that damaged skin, you can develop an infection on top of the HS. Usually it looks a little different. You kind of know, like, this isn't my usual HS. This isn't how it usually looks, or I'm having fevers. So it's very confusing, the whole infection piece, but it's not an infection, not contagious. You're not going to give it to anybody or spread it. And then the hygiene piece we talked about. It's not due to hygiene. It's not because you're unclean. You're not washing enough. In fact, often people who have HS are washing more because you had a rupture. Now I got to go home and take a shower. I have to shower multiple times a day. There can be an odor associated, so some people are doing more hygiene to deal with that. But it is definitely not, it's another shame and blame issue. It is not your fault. It is not due to poor hygiene. It is not anything related to hygiene at all. It starts inside the skin and inside the body. And then why does all this matter? Like I keep saying, we don't want to spread misinformation that's going to make people feel shamed, blamed, make it feel like it's their fault they have it or they could have done something different to not get HS. We want people to get diagnosed. We don't want them to go, well, I don't fit the typical picture of what they're talking about for HS. I must have something else. So I'm not going to go and see someone about it. And then it hurts people when we have these misconceptions, this shame and blame, and then it can get in the way of treatment. So, no, if you're walking around thinking, I have this infection, and someone says, well, we're going to put you on a treatment that will reduce your immune system a little bit. You're like, I can't have that. I have an infection. Or you might even go, well, let me check out that, another sort of misconception some people get is that in HS, your immune system is overactive and overreacting. So some people hear, oh, I have an immune problem, and they think their immune system's weak. And I've had a couple patients who there are some herbs that you can take to boost your immune system, and it can make your HS worse because your immune system's already overactive. So we got to make sure people get the right information and know what's going on so they don't accidentally do something that actually does trigger it to get worse, trying to make it better because they didn't fully understand what was going on. And now we have lots of time for Q&A. I think lots of time, hopefully.
Yeah, you've got 10 minutes for Q&A.
Love it.
Question one, when you, I'm assuming just something, a question I get a lot, people, are the boils often, before they open, right, they're sterile, is that correct?
Right, so some studies have cultured them. So often they're sterile, or they'll have a mix of bacteria that are like normal ones that live on the skin. Yep, commensal, exactly. So, or normal flora, we call it sometimes. And that's one of the keys. If you're thinking like, oh, is this one infected? When there's an infection, they culture it. It's one bacteria that's going crazy and crowded all the other ones out. And that's how we know it's an infection. So if they culture it and there's multiple, then you go, all right, that's just regular old HS.
Maybe a second follow-up. When you mentioned when people think immune boosters, right, talking echinacea and things like that, right, which even in autoimmune patients can make it worse, right? So if people are getting sick, I think a lot of us here, when we get sick, we get a cold or the flu, your HS goes bananas, right?
Yep.
So what would you recommend to do with?
Yeah, and that's a tough one because we see that with a lot of autoimmune things, autoinflammatory, where when anything that triggers your immune system to ramp up and get more active might make your disease flare. Sometimes we even see it with vaccines because vaccines basically do that, tell your immune system, get ready, ramp up, build the army to fight this infection. You should still get vaccines. It's not a reason not to, but yeah, sometimes you kind of got to be ready for it. It's a good thing to talk about with your doctor because sometimes you can get flare treatments that if you know something works for a flare, they can give it to you so you have it on hand and sort of just be ready for it. And then it's hard too because sometimes when you're not feeling great, it's harder to keep up with your treatments, or if you're vomiting, you can't take pills. But yeah, that immune reactivation can be tough.
So when you said that it's not an infection, but what happens when that smell comes? What causes the smell?
That's a really good question. So if there's no bacteria on your skin, you don't actually have body odor. The sweat, the oily sweat that comes out doesn't have a smell. It's once bacteria start digesting it and to be blunt, kind of like farting. They eat stuff and then they release gas. That's what gives us odor, and that's why different people have sort of different body odor. So it's still related to the bacteria is why there's the smell, and that's why sometimes like antibacterial washes might be helpful, but it's not an infection in the sense that it's not contagious. You can't spread it. If someone doesn't have HS, they can literally come up and touch your drainage and it's not going to get into them or cause problems for them at all. So we think it's just that normal bacteria that's all over us. Like we always have bacteria on our skin and in our hair follicles all the time. We actually, if they take your body and they take the moisture out of it and weigh it, we are more bacteria than human. There are more bacteria on us than we make up a human being.
But our skin has essentially like a microbiome as well, right?
Right.
I think like in keeping that in a balance, right? Of like again, comments on opportunistic can also help with that.
Exactly. Yeah. So like we talk about it a lot with the gut, like good bacteria, eat probiotics, Activia. So the skin's the same way. There's good bacteria, and if the good bacteria are covering your skin, there's not room for bacteria that cause problems. Some of the studies have found some bacteria too that we're thinking are more common in HS and might be like your immune system hates that bacteria. So it shows up and starts living there. It's not an infection. Other people it won't live on for some reason, but your immune system hates it and starts overreacting to it. So the bacteria thing is really complicated, and it's extra complicated because the normal cultures can't even grow those bacteria. They had to start doing these like crazy DNA, like ancestry.com on the bacteria in your hair follicle to figure out that they were even there.
That would be like a genetic mutation, like you were saying with the studies about the mutations kind of we have.
Yep.
I have a question. So I have two questions. The first question is, can HS kind of get cancerous because of the open wounds? And also, another question is, what is the connection between HS and PCOS?
Great questions. So the HS can develop cancer. The risk is pretty small, so that's good. What's tricky when they talk about risk studies is sometimes they'll say something like, oh, the skin with HS has double the risk of skin cancer. But if the normal risk is 0.1%, then like 0.2% is double it. So it's tricky when people start talking about like just the numbers. So the risk is small, but it's still an important thing we talk about. It tends to show up in the buttock or the genital region. So we think part of it too might be that that's the area that unless your doctor's really good, they're not examining all the time. But anywhere you have chronic inflammation, it increases the risk that you can get this skin cancer we call squamous cell. It's kind of the type that's very similar to like cervical cancer. So the risk is there. And what's tough for HS patients is usually for skin cancer, I'm like, well, if you have an area that's not healing and bleeding and draining, that could be skin cancer. You're like, that is my HS. I'm like, how am I supposed to know? So that's why we say like it's good to get those areas examined. Sometimes it will look different. It'll almost look like the skin is getting thicker and warty. Again, the HS can do that. But yeah, so there is a small risk of skin cancer, and that's why it's really important to make sure that docs are at least once a year looking at all the areas of HS. And then the link with PCOS, so there's this thing called a comorbidity. And it's this kind of funny medical thing where we look at people and we say, all right, in people who have HS, let's see what other diseases they have and then compare it to people who don't have HS and how frequently do they have those diseases. And we do it for a lot of stuff, for psoriasis, for eczema. So PCOS is PCOS is polycystic ovary syndrome, where it's this hormonal imbalance that can cause you to get cysts in your ovaries. You tend to have more of the male, like masculine hormones in a woman. And so it can cause you to gain weight, grow unwanted facial hair, get acne, get HS, have problems with your period, have problems getting pregnant. And the two can sometimes go together. And we think it might be because those more masculinizing hormones can also sort of trigger HS, which is why some birth control can be helpful, but some birth control can be harmful with HS. There's a list of other comorbidities too, like even heart disease, of course, depression, anxiety, arthritis. And we think it's because you've got that overactive immune system. It can, like we know if you have chronic inflammation, it increases your risk of heart disease. So that's another good conversation, is to understand that HS isn't just a skin disease. Your whole body is experiencing more inflammation, and it can increase the risk of other things, not to freak out about it, but just to make sure that you're, seeing your regular doctor, or making sure that they're checking your cholesterol, your blood sugar, so that we can reduce all the other risk factors for heart disease, and keep an eye on things and just monitor to make sure if you're having any of these things, other problems pop up, we catch them early and treat them early.
So you mentioned in the evidence back today, and you might develop hunger and everything. You might get the liver active oil, might get a very quite a few ways. Might get a pretty close amount. Is that really common for HS that you actually develop liver and all no infection?
It can be, yeah, because it's that immune reaction to it, which, like I said, is sort of the same part of the immune system that would fight an infection. People can get fever, fatigue. I have a lot of patients where they're like, I know a flare's coming because I am drained. I have no energy. And it's like your body is just diverting all the energy to this inflammation. Joint pains are another one that can pop up for people. So it's sort of that idea of like your whole body is inflamed.
So when to kind of recognize when it's an infection versus just a normal life?
One of the big clues is you feel like this isn't my usual HS. Like you've got that pattern of, when I get a big abscess, I get a fever. You might notice more redness in the skin around it. Like if you guys have ever heard of cellulitis, is a skin infection where you get like this redness that spreads really big. It's really hot. Like it feels like your skin has a fever. But that's a big clue for people, is sort of once you know your HS and what it's like, if you're like, this is not my usual HS, this feels different, this is more painful or hotter, or the redness looks different, that's when you can get checked out and see if there's an infection. Often it won't follow your typical flare too. Like, how you kind of know, all right, it's going to flare up. After so many days, it might drain. After so many days, it'll calm down. If it's prolonged and lasting longer, that's another good reason to see the doctor and get checked out.
So these happen to be very often what you get in life and actually go like medical during therapy. Does that mean I have to do something differently if I never go to treat? Kind of suffer through it, not to say that they all fall through, and just how like go through it.
That's one of the things that I wish no HS patient ever had to say, is like, I just have to go through it. I hope you can find someone to treat the HS and prevent that from happening, or at least reduce it. So it's like, when it flares up, it's bad for a day and then I can move on. But so yeah, definitely. I mean, since it is sort of your typical pattern, it's not necessarily like you need to go to the hospital and say, I need to be admitted for antibiotics or anything, but I do hope someone can stop that from happening, because you shouldn't have to go through that. You shouldn't have to be like, when it flares up, I've just got to tough it out. I would hope you could get some treatment that stops the flares. I think we had one over here. Good question. So they said, can it transfer to a child through pregnancy, through the DNA? So it can't spread. So you can't give it to your kids from touching or anything like that. However, it can be a genetic component. So in about 30% of people, or like almost 1 in 3, someone else in the family has HS. So we know there is this genetic piece to it. So that's why I always tell my patients who have kids, especially younger kids, at some point when you're having sort of the puberty talk, or at some point talk to your kids so that they kind of know what HS is. Because what do parents do, especially moms, is they hide all their medical stuff from their kids, and they don't put any burden on your kids, and you don't want them to know that you ever struggle or suffer, right? But it's good to have that conversation so the kids know to bring it up if they start to get boils. And it can just be as simple, like, hey, if you start to get any boils or acne bumps or pus bumps or anything in your armpits, let me know, and we'll talk to the doctor. Because what do kids do during puberty? They're embarrassed about all the body changes and everything that's happening. So they kind of like hide everything, keep it a secret, don't talk to their parents. So because there is a risk that it could come through the DNA to your kids, or they have an increased risk, I say, have that conversation so they know to bring it up. So it sort of depends. So the adrenal gland is one of our sort of stress glands that regulates how our body responds to stress. there aren't super great studies in HS about adrenal support. We also, honestly, in Western medicine, we're not super great about assessing the adrenal function because the hormone levels change throughout the day. So in the morning, your adrenal gland releases some steroid into your system, helps you wake up, feel a little better. That's why, like, at the end of the day, you feel run down. So to really test the adrenal function, you have to do this test where you spit into a tube first thing when you wake up, and then like 2 hours later, and then a few hours later, and then at the end of the day, and they get this pattern of what your hormones did throughout the day. So if you're kind of feeling like your sleep cycle is off, I don't sleep well at night, I wake up in the middle of the night, I'm sleepy in the day. If you're feeling like your rhythm is off, it might be something to talk to your doctor about, because stress can throw off your adrenal function too. And then it sort of ends up being this cycle. But it would be something where I would say talk to your doctor about it and see if they can assess it before you necessarily start like a supplement or anything.